This morning's session was really focusing on our imaging biomarkers of preclinical Alzheimer's disease, which is our tau PET and our amyloid PET scans. We've had the amyloid PET scans available since 2004, 2005, when people really developed the pioneering work with Pittsburgh Compound B. And then through multiple different studies, including in the Diane study, when we published in 2012, we can start to see that we see this amyloid positive scan develop about 15 years or more before dementia. And tau PET is something that's entirely new to the field, just really started emerging over the last 2 to 3 years. And so there's been a lot of interest in understanding how that tau pathology intersects with the amyloid pathology. When we do autopsy studies, we're looking at people who are very old, and we're looking at people who have died of their dementia. And so it's only through imaging studies like this that we're really able to get a glimpse into what's happening in vivo. So during those early phases of the disease, before you get symptoms. And the nice thing that imaging does, as opposed to like spinal fluid or blood test, is we can actually not only know is it present in the brain, but where is it present. And so the focus of all of the sessions this morning was to really start to get at this idea of when and where can we pick up signal from amyloid and tau pathology in the brain. And some of my particular part of the session was focusing on this autosomal dominant model. So if we look in the Diane cohort, as I mentioned earlier, they're very young. So we're looking at people, in their 30s, in their 40s, and it tells us we know when they're going to develop dementia. So it gives us a short-term way to model the data, but it also eliminates what we call comorbidities. So older people have high blood pressure, they have diabetes, they have cancers, all of the diseases of aging that interact with Alzheimer's disease and can change the way the disease comes apart. So what we were interested in seeing was if we look at a pure Alzheimer's model, at a genetic model, how is it that these two intersect? And in particular, when we talk about sporadic Alzheimer's disease, there's been a staging of tau pathology called Braak and Braak staging, and that's been around for 25 years or more based on pathology studies. And under that hypothesis, everyone as you get older, so in your 50s and your 60s, there's an area of the mesial temporal lobe, so the same part of the brain that we know is impacted in Alzheimer's disease as well. But there's a part of the mesial temporal lobe that develops this tau pathology. We call it neurofibrillary tangles. And that's part of what we think of as part of aging. And the main hypothesis right now is that there's an interaction between amyloid and tau such that if you have healthy aging, that neurofibrillary tangles will be restricted to the mesial temporal lobe and that's it. But if you also have beta amyloid Alzheimer's disease in your brain, you have an accelerated spreading pattern. So that tau starts to spread into connected areas of the brain all around. Well, we know that the Diane participants have tau pathology at autopsy, but we don't know where it comes from. Do they first develop it in the mesial temporal lobe, just like regular Alzheimer's disease, or does it come from other parts of the brain? And does it spread in this connected pattern, or does it appear in different places? So we had a really unique sample we were able to investigate. We had participants both from the Diane observational study as well as from the Diane trials unit. So many times in a clinical trial, you're unable to use any of that trial data until the end of the trial because you don't want to break the seal on the trial results. So we were really fortunate that the United States Food and Drug Administration, the FDA, as well as our pharma partners, Lilly and Roche, were willing to give us permission to break that seal for the baseline data, so data before people receive treatment. And we were able to combine that with the data we had from our observational study to get enough data to build a time course that went from about 20 years before symptoms until about 10 years after symptoms. What really we were expecting to see, based on what we know from our other biomarkers, was we really thought we would start to see the tau accumulation in the brain probably 5 or 10 years before the symptom onset. That's what we see in sporadic Alzheimer's disease, and it's the other things about the Diane study have really paralleled that pretty nicely. But what we saw in these people who don't have that age-related tauopathy is they actually, we didn't see that signal until they had dementia. And when they had it everywhere all at once. And if anything, it was more like a posterior part of the brain that had it, not that mesial temporal lobe, which is really fascinating, and I think really is going to drive us to ask some biological questions. So why is it that they don't have it for so long and then suddenly they get it? You know, if we could figure out what it is that led to that transition, could we stop it? Could we prevent it? Could this be a new drug target that we can look at? And it also suggests that unlike the amyloid in these people, where we see the amyloid accumulate over 20 years, it's just relentless, the way it builds up and builds up and builds up, and you kind of struggle to think about how can we stop something that's progressing like this for so long. Now we have the idea, wow, if this tauopathy, which we think is really part of that cell death and synaptic dysfunction, if that's something that's happening very rapidly and suddenly, maybe we really do have a chance to stop this.